Representative Sampson.
Thank you, Mr. Chairman. And thank you for being here, Jim. I don't even know where to begin. You covered a lot of ground in your testimony, and I really appreciate that. But I have a few questions. I guess we'll start talking about the user fees piece of the testimony, and that is how much does the insurance exchange currently take in as far as user fees?
$32 million.
And how many policy holders does Access Health represent?
114,000.
114,000. Do we know how much that is per policy holder?
We do not.
Maybe someone you might want to do that math while we're talking.
I would also caution you, Representative Sampson, that while QHP, Qualified Health Plans, is a piece of Access Health, we also serve about 650,000 Medicaid customers, and we're the enrollment engine for them as well. So if we add all that together, we're going to look at about 700,000 to 1 million Connecticut residents are coming through the front door of our website on an annual basis.
Oh, I'm aware. I am completely aware of what Access Health has become versus what it was told to be when it was sold to the residents of Connecticut a number of years ago. As a way for consumers to access different types of insurance policies. And it has become more or less a way to help enroll people on Medicaid. I don't want to debate that right here with you, but I mean, if that's the response to why does it cost $32 million to sign up 100 and some odd thousand people into insurance at a cost of several $100s a piece, I'm just sitting here looking at the mission statement for Access Health, and I agree with every last word of it because it says to increase the number of insured residents. I want to do that. Improve the quality of health care. I want to do that. Lower costs. I don't think that Access Health has succeeded in that area in any way. The cost of insurance premiums have gone up dramatically. Through an innovative, competitive marketplace, we're talking about an individual mandate to basically fine people for not having insurance. That's not the same thing as an innovative, competitive marketplace. Jim, how many companies are participating on the competitive marketplace that is Access Health today?
So when you say companies that are competing, are we talking healthcare? Are we talking dental?
Health insurance.
Small group, individual?
Health insurance. The average, I mean, there are a lot of different things. I'm certain there are access. I'm not saying that Access Health does no good. What I'm trying to determine is whether or not the cost to the taxpayers of the state of Connecticut, either through taxes or insurance premiums, $32 million, whether or not it's actually worth all of that for what the benefit they get. And to me, the issue is health insurance, individual health insurance products. How many companies are offering products on the exchange?
There are 2 for individual health insurance.
And do you know how many companies were offering those products outside of the exchange?
There are 2 offering those products outside the exchange.
Understood. And before the exchange existed, do we know how many companies there were then?
I can't speak to that.
But there were more, correct?
I don't know the answer to that.
Yeah. Competitive marketplace that empowers consumers to choose the health plan and provider that give them the best value. I just want to remind you of that mission statement when you are testifying in favor of fining or taxing, I don't care how we call it, people who choose not to have health insurance or cannot afford it. Because in my mind, there are only 2 reasons why people don't have health insurance. Either A, they're poor and they can't afford it, and fining them does not seem like a really good idea to me. And 2, they're free American citizens who are making a choice on whether or not they want to purchase a product. And fining or taxing them for that doesn't all seem like it's in keeping with our mission either. Is that the entire operating budget for Access Health, $32 million?
Yes.
And is that all derived from user fees paid by insurers, or is it funded in some other way also?
It's all user fees by insurers.
Did anybody come up with that figure, by the way? $280 per consumer it costs to process each policyholder. Anyway, that's all my questions I have. Thank you, Mr. Chairman.
Thank you. Representative Sampson.
Thank you, Mr. Chairman. And thank you, Commissioner, for being here. Appreciate your testimony very much. Just a question based on a conversation we had earlier. I'm just curious, the insurance department charges user fees of insurance companies also. Is that correct?
Yes.
Do you know the amount of the user fees that are collected by the insurance department?
I don't have those. I can get you the information.
A rough number?
I'm
Isn't
sorry,
it
I'm-
around $30 million?
It's like 30, 32.
Okay, so it's nearly the same as what Access Health does. And how many lives are impacted by policies sold that the insurance department regulates?
That number I'll have to get back to you in terms of, but I mean, it's everybody who lives in the state of Connecticut who's covered under an insurance policy that the department regulates.
Yeah, so million people, maybe more.
Probably more.
Yes, indeed. And the insurance department also regulates tons and tons of products, not just health insurance. Is that
Life,
correct?
property and casualty, health.
Indeed. Thank you very much. I appreciate that information.
Yeah.
Thank you.